Hello everyone, good morning. So topic for today is exterior of a skull, which is my second lecture on the topic of a skull. So we'll discuss about norma verticalis. One by one we'll take all the normas that are there in the skull. So first of all, let's draw a skull, a rough outline of a skull. Okay, it is like if you see it from above, it is oval in shape, right? As you can see, it's oval in shape, and the wider part is posteriorly, it is wider than its anterior side. As you can see, it's wider here and it's like comparatively narrower this side. So, first of all, let's draw some sutures here. So, here I am drawing is coronal suture, right? So, this is coronal suture. This is frontal bone. This is parietal bone. This point here is called bragma. I will discuss all these points in my coming slide. This is, here we have two phenomena called as parietal phenomena. Here we have occipital bone. And here we have lamboid suture. I will tell about all these sutures in coming slide or coming page. This suture here is called sagittal suture. So let's discuss about all these terms that I have used just now. So first of all, let's talk about sutures, right? The very first suture that I told you was coronal suture. Coronal suture, this one, this suture, these two. These are coronal suture. So these are present between frontal and two parietal bones. So where do they run? They run forward and downwards. This is forward and downwards, right? These two, the coronal suture runs this way. Then sagittal suture. It is present in medial plane between two parietal bones. Then we have lambdoid suture. Let me show you where lambdoid suture was. Here it is lambdoid suture, right? So lambdoid suture, it lies posteriorly between occipital and two parietal bones. It runs downwards and forwards across cranial vault. All these points are important for your Viva point of view. Theoretically, they are not of that much use, but yes, in your Viva, they will have a skull with them and they will ask you all these sutures. Metopic means, in Latin, it means forehead. It is present in 3 to 8% of individuals. Like occasionally it is present. It also lies in median plane and separate two halves of frontal bone. It fuses at the age of 6 years. Then we have some more important terms that they ask in your viva in your first year of BDS anatomy exam. What is vertex? Vertex is highest point of sagittal suture, right? Then they ask you about what is vault. Vault of a skull. What is vault? It is arched roof of dome of skull. What is bragma? Let's get back to the diagram. I'll show you where bragma was. Bragma is this point, right? So bragma is meeting point between coronal and sagittal suture. Remember it through this CBS. What is lambda? Okay, before coming to lambda, there is one more important point regarding bragma. So what exactly happens in fetals or in fetal skull? Site of membranous gap is called as anterior fontanelles. So this is very important. Anterior fontanelle, bragma, lambda, they all ask, these are some of their favorite questions of examiner. It closes at the age of 18 months, and the purpose of this is it basically allows brain growth, the fontanelles. Then comes to lambda. Again, I'm saying bragma, lambda, anterior fontanelle. You have to remember all this. These are really important. A meeting point between sagittal and lambdoid suture. Lambda, lambdoid, easy to remember. Just sagittal you have to remember. In fetal skull, it is site of posterior fontanelle. In bragma, we have anterior. Here we have posterior fontanelle, which closes at the age of 2 to 3 months. Now, what is parietal tuber or parietal eminence, and what is its significance? This is area of maximum convexity of parietal bone. And what is its significance? Basically, it is common site of fracture of skull. Then parietal foramina. Remember, I have shown you two foraminas there, two foramens in the diagram here, right? These are parietal foramina. So as the name suggests, foramina, they will transmit some nerves or vessels. So what does exactly they transmit? They transmit emissary veins. Remember, in my first lecture, I have told you about emissary veins. If you have not seen that, you can go and check it out. From veins of scalp to superior sagittal sinus. Then there is one more important point, which is obelion. What is obelion? Obelion is point on sagittal suture between two parietal foramina. Do remember this. This may come as an MCQ question in your NEET exam. So yeah, that is it about norma verticalis. In my next lecture, I will cover norma occipitalis. Okay. So if you have any doubt or you want some more of it, you can tell me in the comment section. Thank you for now. Tata, bye bye, take care.